Hi everyone, my name is Dr. Chloe here at Integrated Health Solutions in downtown Indianapolis, and today I want to talk about something called tightness syndrome, also known as costochondritis. This is a condition where we have pain in the front of our chest through here, so let's talk about what it can be caused by, some of the symptoms, and the best ways to treat it. So first, what exactly is this condition? This condition is referred to as costochondritis, meaning inflammation and irritation between the articulation of your rib and your chest bone, your sternum right through here. Most of the time we can feel sharp pain or pressure-like pain into the front of our chest. This can mimic conditions within the heart as well. So always make sure that we are ruling out any heart issues prior to getting treatment for this condition. Typical symptoms include sharp pressure-like pain into the front of our chest through here, increased pain with deep breaths, coughing, laughing. This can also be associated with pain when we are reaching overhead in front of us or pressing motions. So you might be curious on how this can happen. A lot of times it can be an overuse or a mechanical issue within the body. So positions like bad posture, leaning forward for prolonged periods of time can put increased pressure into the front of our chest here, irritating that joint. Repetitive overuse in terms of bench pressing at an excessive weight for multiple times without proper recovery, reaching too far can strain into the joint through there, and increased pressure. If joints get irritated, we have increased tension within the surrounding muscles of the area. So with an irritation into the front of our ribs here, we can notice tension within our pecs, into the front of our neck, our upper traps, and even pulling into the back. If you notice that you are somebody who does a lot of chest breathing, we take about 20,000 breaths per day. So excessive breathing up into the chest can also irritate the joints within our ribs and putting extra tension into all of our muscles up here. So let's talk about some treatment options. When we have conditions like tightness syndrome, also known as costochondritis, the best treatments are going to be making sure that we can get some safe mobility through the joints themselves, which we can apply an adjustment through the back. Those ribs come in and attach from the back all the way around into the front of our chest as well. So making sure that we have good mobility and not putting any extra pressure through there. We want to make sure that we're attacking the muscles as well, making sure that we can decrease tension through the upper traps, the pecs, the rhomboids, into the mid-back. Dry needling can be a fantastic tool in order to promote healing, decrease tension and trigger point activity, and reduce any irritation through the joint. Lastly, we want to make sure that you have some long-term treatment goals. So incorporating exercise rehab will be a great way to strengthen the pec muscles and the surrounding joints, as well as making sure that we have good posture when we are sitting and if we do work at a desk. That is tightness syndrome, also known as costochondritis in a nutshell. Is it painful? Yes, but it is very treatable. Most importantly, we want to make sure that we rule out any heart issues prior to treatments. So if you are someone who thinks you might have this, come on into our office and have one of our chiropractors examine you to recommend the best treatment moving forward.